I'd like to welcome you to this second session of our webinar on multi-criteria decision analysis. My name is Marian Hummel. I'm one of the assistant professors of the Department of Health Technology and Services Research at the University of Twente, and I have the honor to enlighten you for the next hour on the use of multi-criteria decision analysis. A warm welcome to everybody, the ones who were there last week, but also to the new listeners for this week. So last week we had an interesting session by Maarten IJzerman and Janine van Til introducing the methodology of multi-criteria decision analysis, in short MCDA. And but the focus of the session of today will be much more on the practical use of these methods for MCDA and supporting group decision making. So if you have any questions about how to conduct such multi-criteria decision analysis, you can just ask any questions you have about it. And for next week, we will have a session about the methodological issues about MCDA, and if you have any more complex questions about the methodology, this will be really the appropriate time and place to ask these questions as well. And here you can see all the people who are involved in this webinar. Last week you've heard Maarten IJzerman and Janine van Til about the methodology of MCDA. Today it's me, Marian Hummel, who will present the information about the use of MCDA, and Henk is present in the same room as well, and he will facilitate this meeting and also to structure the flow of questions that are bound to arise during this session. And for next week, Henk will also have a more prominent role. He will also discuss the methodological issues together with Karin Groothausen on MCDA. So this session of today will be about group decision support. I've used multi-criteria decision analysis for several applications supporting group decision making. And I've used in particular one of these approaches. It's the analytic hierarchy process. So during this session you will hear more about this technique, but also about other techniques that are related to this method. And so all my I will illustrate the use of multi-criteria decision analysis, and I will use also my previous applications for this. And in my work I often use it to support the evaluation of new technology. For instance, if developers are working on a new technology, to see beforehand whether it's likely that this new technology will be more valuable than the technologies that are already being applied in healthcare. But you can use multi-criteria decision analysis for supporting many types of different decisions on new technology. So it could be about the development like I did, but it could also be on market access, that you want to evaluate, is this acceptable that this technology should enter the clinical market, or coverage decisions on new technologies. And often if people are making these decisions on new technology, you have to know a lot about all different aspects of this technology. For instance, the benefits, the risks and the costs. So this means that often many different experts are consulted, and then you have to deal with group decision making. And here you see, well, an idyllic picture about group decision making, that every expert gives his part of the puzzle, and with his expertise together they can make a group decision. But if you look in reality, it's not as simple as this. This is also illustrated by this quote. The group decision making is really challenging. It can be that all the different experts have really different ideas and different judgments about the value of new technology. And there might be a dominant group member that really overrules all the other decision makers. So group decision making is really challenging. And for a few of these challenges, you could use MCDA, and especially MCDA is appropriate to support these group panels with experts if they really have to make trade-offs between the different values of a new technology. For example, maybe of a new technology the clinical effectiveness might be higher than the current technology, but maybe there will also be more adverse events that you really wouldn't like. So with these different experts, multi-criteria decision analysts can help them to discuss these different trade-offs they have to make if they really want to decide if a new technology has more value than the existing ones or other types of decisions. So this is really the explicit support MCDA can offer these panels, but it has also more advantages, and I will show you during my illustrations. So what to expect for this session? I will start with a really short recap of the variety of methods for MCDA. Janine, she briefly discussed some of these methods, and for two of these methods I will give a practical illustration and how they could support group decision making, and I will, for these MCDA methods, I will go into more details about the analytic hierarchy process. Janine has also mentioned this technique before, and it's a technique that is often being used in healthcare. But also to show some differences, I will also speak about Macbeth. So the it's a technique it's slightly different. And I will end with a discussion about the recommendations on best practices, how to use MCDA, but also about some criticism on these types of techniques, so you are aware about what to do and what not to do, and what to be aware of if you would use this method to support group decision making. So, well, the three main different groups of MCDA methods, and Janine, she spoke about it, are for one the outranking method, satisficing methods, but also the value measurement methods. And I will really shortly, in a real practical way, I will show you the difference between these different types of MCDA methods. This is an example, a very simple example about outranking methods. This is, for example, if you have new technology, it might be able to be used for the treatment of diabetes. And you have two alternatives: a gold standard from how to treat diabetes, and the treatment with a new technology. Well, here you can see the different decision criteria. Those are the different impacts that you really want to take into account when you are comparing this new technology with the golden standard. For instance, you want to know about the clinical effectiveness of this technology, the adverse events, social impacts, the fit with the organizational context, and fit with the budget. Can they pay for such a new technology? Well, let's say that the golden standard really has major advantages. So for all the different decision criteria, the golden standard performs much better than the new technology. Then it's really clear the golden standard really outranks the new technology, and then an outranking method is sufficient to support your own decision. But now the circumstances are a little bit different. And this is in the context, you have again a new technology, but this technology is really promising. It appears to be better on its clinical effectiveness than the golden standard that's being used now. There are less adverse events. the social impacts are great, the patients like it, it's possible for the hospital to acquire this technology. Only there is one sole issue to consider. It's that the new technology doesn't fit as well as a golden standard into the current organizational context. For instance, work processes need to be adapted. And then if you say, well, but still it's worthwhile to adapt the organizational context, then you could say, well, this is a satisfying decision if you just choose the new technology. So then a satisfying methodology is appropriate to be used. But now again the circumstances change again, and now it's slightly a bit different. You have the new technology with different advantages, but also the golden standard has some advantages. So the performance of the new technology is in a gray area, so you're really not really sure which technology to choose. And then you can use the value measurement methods, in which you want to know, well, but how important are these different advantages then? So you can give the weights to the different decision criteria. For instance, you say very simple, the most simple way, okay, the clinical effectiveness receives the highest weight, as well as having minimal adverse events. Social impacts are important, but not as important as the previous ones. And what you can do then is just to count the advantages, but multiply it by the different weights. So for the golden standard, it receives a 3 plus 1 is 4, and the new technology receives a score of 6. So this means, okay, it's more likely that the new technology might be in favor over the golden standard, so this would be an interesting new technology for us to consider. But for these types of decisions, the value measurement methods are quite important if you want MCDA to support your decision-making process. And so for this session, we're also focusing on these type of methods, the value measurement methods, and the AHP and Macbeth both are within this group of MCDA methods. And within these value measurement methods, you have several of these MCDA methods, and it's always difficult to choose which one I really would prefer to use to support our group decision-making process. And well, very basically, you have two different schools of MCDA, and both they have developed their own methodologies. And one clear example of the American school of MCDA, they developed the analytic hierarchy process. It's one of the most often used methods for MCDA within healthcare. And the European School of MCDA, one of their methods is the methods of Macbeth. And so just to show you the differences from these different schools, I selected as an example these two different methods. So in a nutshell, what is the analytic hierarchy process? It will be very fast, but during this session I will go into the different steps. So if it isn't clear, it will probably become clear during the session. And what is AHP, in short for analytic hierarchy process? What it does is, first of all, and some say this is even the most important part, is that it structures a decision problem into a hierarchy of criteria, subcriteria, and alternatives. So you really think about the different alternatives, the alternatives you would like to compare to select, for example, the highest performing alternative. And then you think about the different criteria that are necessary to consider if you want to compare these different alternatives. So you have the criteria, but if you say, well, you also have some criteria that can be subdivided in different subcriteria, you use them as well in this decision hierarchy. And then the next step is that you're going to assign weights to how important are all these different criteria and subcriteria, and how well do you prefer these different alternatives with regard to these criteria, and Janine showed you also a simple example of this. And what is the essence of the analytic hierarchy process is that there are always pairwise comparisons that are used to help you judge how important, for instance, the different criteria is. So the pairwise comparisons are about two different decision criteria, for instance, the clinical effectiveness compared to adverse events, that you say, well, which one of these two is important and how much more important is this one? And by using these pairwise comparisons, it will be possible to calculate in the end the weighting factors to show how important you think these different criteria are and how well the different alternatives perform on these criteria. But it also helps you to generate an inconsistency ratio, and I will show you later, but this is just a measure to show if your judgments make sense, if they don't violate all the mathematical rules. So it's just a check if you have made some really strange judgments. So this is really in a nutshell the analytic hierarchy process, and if you would look then at a short description of Macbeth. And then if you look at it, also Macbeth structures the decision into a hierarchy of criteria and alternatives. And also Macbeth is using the pairwise comparison to compare the different alternatives, but also to compare the importance of the decision criteria. It also generates inconsistency ratios, and it also helps to compute the weighting factors to prioritize the criteria and alternatives. So at the first glance, both methods appear to be really similar, but you will see in their procedures, in their mathematical algorithms, there are some important differences. So I just wanted to have this clear, that I will start with an illustration of the analytic hierarchy process, just because it's the method for MCDA that is most often being used within healthcare, but it doesn't mean that the HP is the best method to use in healthcare, because I think any method of MCDA has its flaws, and also the HP has them. So it's important to be aware of them. But well, the AHP is the best known method for MCDA, so I will start with an explanation of the AHP first. And this is an overview of the different MCDA steps, so all the different steps that you have to undertake when you are applying a technique like the analytic hierarchy process. And I will, by means of an example, I will go through all these different steps, so you don't have to know them now, all 8 of them, but I will go through them one by one. So first we start with the definition of the decision problem and the decision goal. So let's say there are all different new technologies that are currently being developed and on the verge of being implemented in healthcare. And one of those types of new technology that are being developed are the smart pills. And there is one smart pill in particularly. It's a nano pill, and it can also be used to detect colorectal cancer. And it's just a pill that can be swallowed, and by means of the nanotechnology within this pill, it is possible that the gastrointestinal tract is being inspected to check whether it's likely if a person has colorectal cancer or not. And this might be a really interesting new development that, especially for some patients who really would like to avoid a colorectal exam, a colonoscopy, could be interesting for them if this new nanopill would be used to detect colorectal cancer. So there might be a hospital that is interested in clinical trials with such a nanopill to detect colorectal cancer, and they have a group decision-making team that's going to advise them whether it's has advantages for them to pursue a clinical trial with such a nanopill. Well, they have an expert panel of six group members. They have 2 patient advocates, 2 oncologists, and 2 gastroenterologists. And these 6 people, they are going to discuss if how valuable is this nanopill, and do they want to use the clinical trials, and do they want to expose this new technology to patients? Is it good enough for this? So it's an important decision for this hospital, and they decide to use MCDA to support their group decision-making process. The next step, what they're going to do, is to identify and structure the decision criteria and the different alternatives. So they're going to think, okay, what are the alternatives? For instance, what are the current technologies that are now being used to detect colorectal cancer? And what are all the important decision criteria? And they came up with the following structure. It's just some hypothetical example. So you have the nanopill, it's the new technology they want to compare, and they say, well, the existing alternatives that we want to compare the nanopill with are the FOBT. It's a stool test to detect blood in the stool, and that could be an indication that a patient could have colorectal cancer, or the colonoscopy. And then they were deciding about the different decision criteria they want to use. And there are all different possibilities how you can come up with all the different criteria and sub-criteria that might be relevant. For instance, you can check the clinical literature, but you could also have a first proposal based on clinical literature, and then let the expert panel decide whether there are some decision criteria forgotten, and you can adapt then the decision structure. But they came up with, it's important, the sensitivity. So if you have colorectal cancer, that this test is be able to detect it, and also the specificity. So if you do not have colorectal cancer, that the test also confirms this. So you won't be sent to the hospital for follow-up tests, while these tests might indicate that there is no cancer at all. The safety during the test, and also the comfort. And this is one that is subdivided into 2 sub-criteria. It's the convenience during the test, but also the frequency. How often, how many years can be between 2 different tests. And this is the structure of the decision problem that they are using to support the decision whether the nanopill, if it's likely that the nanopill has advantages over the current alternatives related to all these different criteria. And then we arrive at the next step, and this is the judgment on how well these different alternatives fulfill these different decision criteria that they have formulated, but also their judgment on how important are these different decision criteria. And to judge the value of the alternatives and the importance of the decision criteria, they are using these pairwise comparisons. And this is an example of one of these pairwise comparisons that you can judge when you are using the analytic hierarchy process. And here you have the 2 alternatives that are being compared. So always you are comparing 2 alternatives. This is the FOBT test, and here you can see the nanopill. And then you're going to look at just one of these criteria, the sensitivity. So regarding its sensitivity, which alternative do you prefer and to what extent? And then they can score on a scale from 0 to 9, which one they prefer. For instance, if you say, well, I do prefer the nano pill because the sensitivity is higher than the FOBT test, then you will give a score on the side of the nano pill. And a 3 just means it's moderately more preferred than the FOBT test. If you would have given a 9, then it would say the nano pill is extremely more preferred than the FOBT test, and the 1 means they're equally preferred. So, and for the AHP is actually a ratio scale. So if you would give the score of 3, and when calculating the different weights, the priorities of the nano pill would be 3 times higher than the priority of the FOBT. It's really a ratio scale, not an ordinal scale. And you have different pairwise comparisons that you are going to make with this decision structure. The first set is that you're going to compare for each lowest level criterion which of the alternatives you prefer and to what extent. So if you look at this decision structure, you're going to compare each set of 2 alternatives for each of these lowest level decision criteria. And then you want to know, well, how important are then these different criteria? And then you start with comparing the importance of the different sub-criteria. And then as a last set of pairwise comparisons, you are comparing the importance of all the different main criteria. So if you look at this different here at the decision structure, you start with comparing the alternatives for each of these lowest level criteria. Then you are comparing the importance of the different sub-criteria with each other, and then the importance of the different main criteria. So here the questions could be, what is more important to you, the sensitivity of the test or the specificity of the test? And with all these clusters of pairwise comparisons, it will be possible to calculate all the different weights and priorities. But maybe if you're working in groups, then maybe not everyone will have the same judgments on any one of these pairwise comparisons. So if you're making the group decisions, then you let the different group members judge all these pairwise comparisons. And for some techniques, it's always very important to check whether you have sufficient respondents to make really accurate or valid judgments. But here for the analytic hierarchy process, they do not have strict guidelines on how many people should be involved when making these group decision makers. Like one of the quotes of the founder of the AHP, Professor Satie, he said, well, you can involve 1 million people, but if they really don't know the context, do they know more than if you would involve 1 expert? So if you have, like here, a group of 6 experts, it's really important that you have the right expert, maybe more even that you have several hundreds of these experts involved. And if you're making these group judgments, you can show the different pairwise comparisons here. For instance, you have the same pairwise comparisons as I showed earlier. It's a comparison between the nano pill and the FOBT test regarding their sensitivity. And it could be, I showed you the judgment of 3, but it could be within a group of 8 persons that all these persons have different opinions, but they all have a preference for the nano pill. Then it's possible to show all these different judgments. And if they, for instance, if there would be a few who would prefer the FOBT and would give judgments over here, it would be visible for them, so they can all discuss these different judgments, maybe share some information that was not available yet for all the group members, and they can revise their group judgments and give their final judgments. And it's never necessary to end up with a consensus. It's just possible to calculate a group average to indicate the final group judgment. And this is actually, if you're going to use the software package of the AHP, how you would see this scale, this double 9-point scale with the comparisons. And so this also is an additional support to group decision making, that it not only helps you to make the different trade-offs between the advantages and disadvantages of technology, but also to support the group members to share information, or even to share, to come to a consensus, but it's not necessary, like I said before. And then the inconsistency check. I mentioned it earlier. What is the inconsistency check? It's that, for instance, you can see it as the infinitive ascending stairs by Escher. If you as a decision maker, if you say the first criterion is more important than the second one is more important than the third one, but the third one is also more important than the first one, in a mathematical way this isn't possible, and then the system would say, well, these judgments appear to be not plausible, so it might be wise to revise some of these judgments because it is really strange, this combination of judgments. And a more practical example is this. For example, here they are comparing, again for sensitivity, how much the decision makers prefer the different alternatives. And first they say, well, the nanopill is preferred over the FOBT test. And to a less extent, but the nanopill is also preferred over the colonoscopy. Then it wouldn't make any sense if they, as a last judgment, if they would claim that they think the FOBT is better than the colonoscopy, because you would expect that they would prefer the colonoscopy. And then it gives a remark that there is the inconsistency is increased, and it might be suggested to revise one of these judgments. So if you end up with judgments on all the different pairwise comparisons, but also if the inconsistency is checked and there are reasonable judgments, then it's possible to calculate the weights of the criteria that represent how important these criteria are for your decision, and the priorities of the alternatives that reflect how much you prefer one alternative over the others. Well, this is an example what you could see if you use the analytic hierarchy process. Here you can see in this case, the four main criteria of this decision problem: the sensitivity, specificity, safety, and comfort. And how high these different bars are, this reflects how important they are. So they say, well, for their decision, if they really wanted to be examined with one of these screening techniques, they say, well, comfort is really important for me if I would come to such a screening or not. And they say, well, the second most important criterion is the sensitivity, followed by safety, and the least important one is the specificity. And then here you see the three alternatives. It's the nanopill, the FOBT, and the colonoscopy. And if you look over here, you can see the nanopill is the highest on sensitivity. So it says that the preferences for the nanopill are higher than on the other alternatives if you would think about the sensitivity. That's a little bit different if you would go into the specificity. Then it's thought to be equally preferred as the colonoscopy. But the colonoscopy regarding safety and comfort, it's not so preferred. So this means if you would look at the importance of the criteria and how well they score on all these different criteria, here you can see the weighted average. And for the weighted average, it suggests that the nanopill is the technology most preferred according to this group of decision makers, followed by the FOBT test and the colonoscopy. So this might suggest that it could be interesting for this hospital to seriously consider clinical trials with nanopill, because it has some disadvantages, but they appear to weigh up against more important advantages. So this is an illustration of the overview you will get when you are using the analytic hierarchy process. And but there are many different software packages. This is just an overview of the different software packages that I found, but there are some open sources, but also some commercial software packages for the people who are interested in using this analytic hierarchy process. And then the second approach by Macbeth. So again, also Macbeth uses the different pairwise comparisons, but they are different than the analytic hierarchy process. So you can see it's how they frame the question behind the pairwise comparison. So regarding their sensitivity, what is the difference in attractiveness of the alternatives? And they use not a 9-point scale, but a 7-point scale. And the 7 means extremely more attractive, and 1, no difference in attractiveness. But there is a really important difference with the analytic hierarchy process, and that is that the analytic hierarchy process has a ratio scale, but this Macbeth, it's really an ordinal scale. So only what they know is when you say that a strong difference in attractiveness is, for instance, a stronger difference than a moderate difference in attractiveness. And with linear programming, it becomes possible to have a suggestion of the different weighting factors, but it's not a fixed number like the HP. If you say give a 3, that the weight should be 3 times higher, but they just know that it's an ordinal scale. So this is quite different in the calculations with Macbeth, and it uses a 7-point scale instead of a 9-point scale. And for the different sets of pairwise comparisons they are going to ask is, again, they start with the preferences or the attractiveness of the different alternatives with regards to each lowest level criterion. And then they ask for comparing the importance of all lowest level criteria. And this is also a minor difference between HP and Macbeth. So again, you're going to compare the sets of 2 alternatives with each lowest level decision criteria, but then you are going, in the next cluster, you are going to compare all these lowest level decision criteria. So now you're going to compare these 5 decision criteria. And maybe you remember from the HP, then you're going to compare just these 2 with each other and then the main criteria. But here they're going to use one overall matrix with all the lowest level decision criteria. And I see one question coming up, and that's a really good question I see. It's the question whether the amount of pairwise comparisons will it differ among the HP and Macbeth, and really that's really good because it really does differ. Here with the Macbeth you will actually have a little bit more pairwise comparisons than with the HP, because you have to compare, especially for larger structures, you have to compare more criteria with each other. So the amount of pairwise comparisons to compare the importance of the decision criteria will often be larger than with the analytic hierarchy process. And so this is a screenshot of Macbeth about different pairwise comparisons to make. And then you see instead of 4 decision criteria with the AHP for comparing the importance, here you have all the 5 decision criteria together. You're going to compare the safety if it's more important than the sensitivity of these screening techniques. And so you're going to systematically are going to compare all the different pairs of criteria with each other, which one is more important, and how much more important is it. And this is an example of the results you can get with Macbeth. You also have here the different decision criteria, and again the bars represent how important they are, but by calculating these different weighting factors, it was an ordinal scale, so it's possible they also give you the range of weights in which your judgment still would have made sense, because it's not the same distance always. If you say something is moderately more important than another criterion, it could mean that it is 2 times more important or 4 times more important. So what they suggest is also a range of weights in which your judgment makes sense. And then you can adapt if you think, well, but I still thought that frequency should be a little bit more important, and it's possible to adjust this weight. And the same with the priorities of the alternatives. Here it's solely for sensitivity. And with Macbeth, it's always that the least attractive alternative receives a priority of 0. And the most preferred alternatives is assigned a priority of 100. And here you can see that it also gives the range of the colonoscopy, because the nanopill was the most preferred one. Even if the colonoscopy, the priority would be higher, it would still have sense, this priority regarding the different judgments that were given. So also for here it's possible to adjust these priorities. And when you have given the final priorities, then there will be an overall score of all these different technologies regarding the different decision criteria. And again, it's it is an additive value function, so it's the weighted sum will be used to calculate the overall attractiveness of all these 3 alternatives. And for now, the 0 points are assigned to a fictional technology that would have the lowest preference on each of these decision criteria, and here the highest preference of these decision criteria. And then here you can see the priorities of the 3 alternatives, the real alternatives in our example. And also for the ones interested in using Macbeth, here you can see the internet page with this program of Macbeth. So if you would compare the AHP and Macbeth, you can see that the AHP, well, it's frequently being applied in healthcare, and there are some best practices being established for using this technique. And it's rather user-friendly how it supports the group decision-making process. What I really like is showing these differences in opinion between these different group decision makers, so they can discuss all the arguments lagging behind their judgments. But it's also important, I think, to be aware of the methodological critique on the AHP. You should be aware of the elephant in the room, because we also have a tutorial, and the methodological criticism are described in more detail in this tutorial. But there are some criticism because the HP uses this ratio scale. So it might be, if you would say one alternative is extremely more preferred than the other one, it might not really well present your opinion that this priority is then 9 times higher. Maybe you say, well, it should be 30 times higher. So using this ratio scale, it has been tested that it often resembles the actual preferences, but there is some criticism, and I really understand this criticism on this ratio scale. And there are some other critiques, for example, how these weights are calculated. But my opinion is that it's very important to know how to use such a technique, because it gives them the main advantages and disadvantages of these different alternatives. And if you would use a slightly different weight calculation algorithm, and there would be another alternative that would then be the most preferred technology, it would never be enough to solely base on this algorithm your choice for new technology. I think it's of utmost importance that you just realize that it supports your insight. What are the different advantages and disadvantages, and are they really important or not so important? And you shouldn't only base your final decision on minimal differences in weights or priorities. Just use it as a tool to make the group decision-making process more transparent, and that you make sure that all the important decision criteria are involved if you're going to compare different technology. So my advice is really to use it as a means to support the group decision-making process and not to replace group decision-making, because it's the decision-making themselves who really should be able to argument their choices and not be dependent on one specific algorithm that is being used in your application. And then we have the Macbeth. It's not so often being used in healthcare, and but there is less critique on its methodology. I think it's rather interesting to use some of the best practices of the AHP to make also its support the group decision making more user friendly. And we have also an outstanding student, Leah, who is present as well here. She's working on this combination. And what's also a bit different is that since you will get such overview of how well these alternatives score, you are going, in fact, for the insiders, you're going to build value functions for these alternatives, and it's best applicable if you have at least 2, but preferably more alternatives to compare within the Macbeth. And since all the different criteria are all compared with each other, it's less applicable in case when you have, for instance, more than about 9 criteria that you want to consider in your decision, because then the amount of pairwise comparison will very fast increase. So I think for the decisions that are not too complex and with less than 9 criteria, the Macbeth is really an interesting technique to use as well to support decision making. And if I would go, oh yeah, and this is the tutorial if you are interested in the analytic hierarchy process, but also on the critique on this analytic hierarchy process and the response on this critique by the people who are working with the analytic hierarchy process. This is a tutorial and also explains in more details all the different steps of applying the analytic hierarchy process. This is something that you can read as well. So everybody who wants to know more, just email and we will send you this tutorial. And to just shortly refer back to the slide of Janine van Til. It's good to realize that, like I said before, that MCDA will not give you the right answer. It's especially, what I think this slide is much more important, it just helps you with in a structured way to decide for instance, to select new technology that might be promising, and it just helps to highlight you the different trade-offs that you are making and to make the decision-making process and all the things that you are going to consider when making these decisions transparent. And it's really a tool to support you as decision-making, so never to replace the actual decision to be made by the decision makers. And you probably have some questions about either the AHP or Macbeth. So there is plenty of time to ask me now at this webinar, but it's also possible to always mail me later at this email address, and I will try to give an answer to your questions. But what is also very important for the questions is also for the web session for next week, that in this session Henk would really like to go into details for the most pressing questions you might have. So if you have any questions about also the methodology of MCDA, just let us know, because then Henk can adapt his session and go into these questions next week. So I'm looking forward to your questions, and we will see you, I hope, next week, the 23rd of April, for the session with Henk and Karen about methodological issues of multi-criteria decision analysis. Thank you for your time and attention.